Greetings and thank you for joining the 2020 Association of Schools and Programs of Public Health, or ASPPH, virtual annual meeting session entitled Implications of Higher Ed Trends for the Future of Education in Public Health. I'm Liz Weist, ASPPH's Director of Education. Next. You are encouraged to stay close to your device during the webinar to engage in a bidirectional fashion with the speakers who have questions for you. Using the question and answer mechanism here, you may ask questions in writing anytime during the webinar. Simply click on the Q&A button on the bottom of your screen and type them in the pop-up box. Of course, your own ideas, reactions, and questions are welcomed at any time during the presentation. Shortly after the conclusion of this session, the recording will be available on the ASPPH website. We encourage all who are certified in public health to take advantage of the 1 hour of continuing education credits conferred by this webinar. Next. Your moderator for today's event is Dr. Shan Mohammed, clinical professor at Northeastern University's Master of Public Health program. Dr. Mohammed is also the chair of ASPPH's Education Advisory Committee. Please join me in welcoming him to the mic.
Thanks very much, Liz. And also I want to extend my thanks to the other staff members and leadership of ASPPH for making this virtual conference possible. I also want to thank those of you who have joined us today amidst the challenges that we are both personally and professionally facing with COVID-19, the pandemic. We clearly are living in really unprecedented times, and when we take the position of our students and our institutions, we can see many challenges that we're needing to respond to. So especially thank you for joining us today. I think this pandemic is also a further cause for us to reflect on the roles and responsibilities of academic public health to improve the health of individuals, families, and communities everywhere without exception, to hold true to our ideals of social justice and health equity. It's also incumbent on us to reflect on how we as member institutions of ASPPH can strengthen our collective capacity to advance leadership, excellence, and collaboration for academic public health. So as we begin this conversation today about trends and challenges in higher education, there are clearly many themes that have emerged and have been talked about and published in other domains that I'd like to briefly note just to frame our conversation today. So for institutions, we know that financial health and financial sustainability is a growing concern, particularly knowing that there has been decreasing state support for public education in some areas. Additionally, we know that there is a strong influence of rankings that have an impact on the actions and priorities of our institutions that can have an impact on our public health programs and degree offerings. Additionally, others have noted and documented a loss of confidence amongst the greater public in terms of the value of higher education. Secondly, from a faculty perspective, these concerns continue about the sustainability of our institutions and particularly the closing of deep degree programs, colleges within institutions with declining enrollments. We've also seen an incredible growth in online educational offerings across disciplines, which challenge us to respond in new ways. And consistent across millennia is the issue of quality teaching. How do we know that what we're doing is having the intended impact we want on our students and on our communities at large? So how do we think about the adequacy of our training to implement best practices, whether those are evidence-based and data-driven, or if they're evidence-informed, particularly given the diverse contexts in which each of our institutions lives? And then another final impact for faculty is how many institutions are becoming more and more dependent on part-time faculty. And what does that mean? How do we respond to these emerging challenges in public health with those changing dynamics? Thirdly, for students, we know there's a decrease in the US student population for college-age matriculation. We know there's an increase in our non-traditional students, and many of our students are coming with diverse needs, whether that's language, whether that's differing abilities, In past conferences, we've talked about the challenges regarding mental health concerns that can impact learning that occurs and just impact the educational environments in which we teach. And there's a lot of discussion about this competitive market that we are living in and the concern that admissions is becoming a sales operation, and the retailing perspective raises many concerns and challenges. But fundamentally, from the student perspective, what do our students need to become competent and compassionate public health professionals, but also engaged citizens? And so that trickles down to our degrees and how we think about what's affordable. We know that there's been an increase in tuition and fees that has outpaced inflation. And so how do we think about our degrees to meet current demands so that our graduates can be competitive in the marketplace? But also, how do we think about the future for those jobs that have yet to emerge, new expectations, competencies that our graduates will need, whether that's around data and data analysis, artificial intelligence, or rapidly advancing technology. So as Dr. Frank mentioned in our prior session, this is an incredible time for opportunities. How do we best advance our academic cultures so that we can embrace innovation and appropriately build and grow as a profession? How do we focus on measuring our learning and advancing the scholarship of teaching and learning in our programs and schools of public health? And how do we rethink how institutions might work and collaborate more effectively to deepen our networks, to establish effective consortia with our regional, national, and global partners? So with that as a framing context, it's my honor to introduce our presenters. Today we have David Shoham, who is the director of the MPH program at Loyola University in Chicago. We have Julie Kornfeld, who is vice provost for academic programs at Columbia University and an associate professor of epidemiology at Columbia's Mailman School of Public Health. And we have Tricia Pennycook, who is the vice dean for education and faculty affairs at the University of South Florida College of Public Health. All three of my colleagues and speakers are on the ASPPH Education Advisory Committee and its subcommittee, which is working to identify trends in higher education to build on the Framing the Future initiative. Just to remind you, we would like to have this as engaging as possible. And so each of the speakers will be posing questions to you during their presentations, and they will be numbered. We have 3 speakers, so each set of questions will be preceded by a number 1, a number 2, or a number 3. So as you answer those questions, we'll be monitoring the Q&A section of the webinar, and it would be helpful if you just put the number 1, number 2, or number 3 before your response so we can more rapidly collect those responses and share that information out to you. So at this point, it's my pleasure to turn over the presentation to David Shoham.
Thank you, Sean. So as Sean introduced me, I am the director of the MPH program at Loyola University of Chicago, now director of public health programs at Loyola, as we've added a bachelor's program. And I'll just begin with some trends. This is based on a cohort of 50 ASPPH members that was conducted by the data center. Christine Plepis and her colleagues have put these data together. And it shows that among these 50 institutions, the master's degree has been growing over time. And it was projected to decline over the immediate future, but it is unknown what impact COVID-19 is going to have on these trends. We're hearing about public health every single day, and we're really in the spotlight now. So it could be that this leads to higher enrollments. At the doctoral level, things have been holding steady. Not included here is the bachelor's degree level, which has shown rapid increase at many institutions. The price of the public health degree, particularly the MPH degree, remains a concern at Loyola. It costs about $47,000 for a student to obtain the MPH degree, and I imagine many of your institutions are in this ballpark, maybe a bit higher, a bit lower. But it's a quite expensive degree, and we want to make sure that students are able to repay their loans and justify the cost. Now, there are a number of other reasons for obtaining an MPH degree apart from the salary that one is able to get upon graduation. Of course, there's personal enrichment, professional development, etc. But it still is true that students will have to either pay for this loan or pay for this degree out of pocket or take out loans. And so we want to be mindful of what salaries they're able to obtain. And the good news is that the salaries for an MPH graduate are quite competitive. The median is $60,000 per year. Obviously, there's a range all the way down to $12,000, all the way up to $136,000. But you'll see that the interquartile range is quite good, and the salary is above what many students, at least at our institution, are paying for their degree, even if they're financing the whole degree through loans. We're not anticipating that there's going to be much growth in salaries. Of course, this could change. We've heard a lot of talk about the aging public health workforce. Many people entered the field in the 1960s and are now approaching retirement age or have entered retirement. So there are a number of vacancies that are available. Of course, it's going to depend on funding. I think the COVID-19 pandemic has awakened everyone to the importance and need for public health, and particularly those responsible for hiring public health graduates. This is not particular to public health degrees. These are data from the College Board showing the expected earnings at various degree levels, from associate's degree all the way up to doctoral and professional degrees. And the key feature here is to look at how much extra lifetime earnings are afforded by obtaining an MPH degree. And it's quite substantial over the course of the lifetime. Obviously, having a yet higher degree in terms of doctoral or professional degrees leads to greater earnings over the life course. But it does look like the cost of the degree is justified, at least at current salaries. But there remains the looming question of debt. These are trends in graduate student debt. Again, this is across all institutions of higher education, data from the College Board, not particular to public health. These data are not from ASPPH. The trends in student financial aid show a pretty substantial increase from a couple of decades ago. Although it does appear that they have flattened out. There was a big jump during the last recession. It looks like we're entering another recession now, if it's not officially been declared yet. It's quite likely that there will be a lot of people out of work. That tends to drive students to pursue graduate degrees. So that is not a primary result of the COVID pandemic, but is a secondary result with the loss of jobs in the economy. And it remains to be seen what the appetite is for students to take out large amounts of student debt. Many are already entering graduate school with substantial undergraduate debt, and that has to be part of the package and their ability to repay over time. There is projected job growth in many public health professions. As an epidemiologist, I'm always a bit dismayed to see that there's only 5% growth in epidemiology, although the salary is quite good for epidemiologists, close to $70,000 per year. That's at all degree levels. I imagine that job growth in epidemiologists is going to increase, again, as many people, not just the public health professionals who already know the importance of epidemiologists, but people in government generally and the public understand the critical role that epidemiologists play in controlling disease. And this is my final slide before moving to my questions. It's interesting to look at the sectors that our graduates are going into. So these are data from ASPPH, so this is specific to recipients of public health degrees. At the bachelor's level, the mode is to go into for-profit. At the master's level, it's into healthcare, and at the doctoral level, it's into academia. So I'm not terribly surprised at the doctoral students going into academia. That's what many people pursue, particularly PhDs for, but also DRPHs. Aim to go into research, and academic settings are the primary home for those. At the master's level, healthcare is the largest sector. I am surprised that for-profit is the largest sector at the bachelor's level. And given the conditions created by COVID in the economy, it's not clear that that's going to be the largest market for our graduates. So with that, I will leave you with a couple of questions. Well, question 1A and question 1B, so one question in two parts. So how can we increase the return on investment of the MPH degree in particular? This could be through regulation. Reduction in number of credit hours is something that many of my colleagues have asked me to bring forward to ASPPH and to the Council on Education for Public Health. Why is it 42? Do we need so many hours? We could reduce the cost of the degree if the hours were reduced. There are also things that we can do at the institutional level, reducing tuition per credit hour costs, reducing the cost of attending for part-time online executive education and other novel modalities. And we can certainly discuss how much cost savings there is actually there. It does allow students to remain working full-time, and of course increase in scholarships and grants. And the other part of the question is, what is going to be the impact of other degree levels, the BSPH and DRPH? I realize I'm 1 minute over, so I will end there, and I will turn it over to Julie.
Hi, everybody. This is Julie Kornfeld. I'm the Vice Dean for Education at the Mailman School of Public Health, as well as Vice Provost for Academic Affairs, wearing two hats at the moment. Pleasure to talk with all of you and to join you for this conference virtually. So I'm going to shift gears a bit and talk a little bit about the case for change in terms of diversification. And so I think David talked a bit about return on investment specific to our degree programs and salaries. And one of the things I know from our previous meetings and from my own discussions here at Columbia is that, you know, we've been constantly looking at how do we diversify our educational portfolio. I think what's happening in the world now not only solidifies that, but potentially actually amplifies our need for diversification. And while I think many of us have unique needs within our own institution for why we might want to diversify and how, I do think there's a couple of things that are kind of unique or uniform or approachable or applicable to all of us. So just to highlight some of those things that I've used in conversations I've had, both at the national and at the regional level. And I think my colleagues have already really talked quite a bit about national trends in higher education, and how does that impact the decisions that we make in terms of our need to diversify. Some of the changes in public health education, the growth in online education. I know at last year's ASPPH we really saw that kind of the only uptick in applications were in programs that had online education, and I think that motivated a lot of us to have additional conversations at our own institution. And again, I had this line in here before this week, but I think becomes even more relevant. The need for our expertise and our science in public health, I think is certainly amplified in this particular moment. I think many of us are looking at how we expand our revenue base in terms of our education. And I think something that's really important to all of us, and certainly nationally, is how do we continually establish our reputation as leaders in education, both in innovative education and education that's really truly needed by the world right now. So again, I'm not going to spend a lot of time here because I think my colleagues did that already. What I'd like to do is just, I think one thing that we've seen a growth in online education. I think we've all seen and experienced a demand for flexibility and customization. People want to be able to stay in place. They want to be able to meet their unique needs and customize their educational programs for their own needs. I think the other thing that we've seen nationally is that most of us have engaged in institutions of higher education as a one-time engagement for our bachelor's degree or our master's degree, but really thinking about as fast as the science is changing, particularly in public health, but in other instances as well, how do we move from being a place that people come once for education to a place that people continually engage for their lifelong learning in terms of continuing education, in terms of professional education. And I think the other piece I'll mention is that there are other innovative partners in this space, right? So we've all been contacted, many of us, by Coursera, by other partners about how they want to engage in public health education. And I think we have to be aware that those trends are out there and that we have to innovate ourselves or partner to innovate. I'm not going to speak much about the decline in MPH applications because I think we have that. But I think in terms of the diversification, that's another driver in a different way, right? So if we are seeing facing the fact and the reality that many people can't spend a tremendous amount of money, give up 2 years of their life, earn 42 credits in residence, how do we respond to that need? And how do we do it in a way that's accessible and open to different learners? In terms of diversifying our education portfolio, I think the next question is then who are our learners and how do we reach them? And there are things that have to be done in terms of market analysis and what are the right directions to move and where are the right investments to make. But I think, we've all talked about what are the signature programs of our own institution, and are we sure can we transition them and offer them in multiple ways, whether it's a fully online or perhaps a hybrid mechanism. Whether this will reduce costs, I think is something that there's a lot of discussion about and varies among and between institutions, but it's a variable that I think needs to be considered. I think one of the things that happens as we move more into the online or the hybrid space is that we have the ability to build and customize and tailor educational programs in ways that perhaps are particularly meaningful to individuals. And in fact, obviously, we can allow people to perhaps remain in place and in the workforce and earning money when they're engaged in their public health education. And from a global perspective, they might be able to remain in place. Again, I think this particular epidemic puts a very fine point on our ability to be facile, to switch to different modalities in learning. And when we don't have capacity, trying to gain that capacity and a crisis situation is really challenging. I know I mentioned to my colleagues on the panel yesterday, I made a case a year ago for the need for a director of online learning. I'm very glad that I was able to convince and make that investment because it's come very much in handy over this last 3 to 4 weeks. But I think we all are making cases for what investments we need to make. And so I think that's one thing that's important. I think the other thing is around what else is a credential that we might offer in terms of diversification of learners? Are they certificates or are they just short-term non-credential earning kinds of programs? I think there are a couple different audiences here as we think about diversification. We have our alumni, if we want to continually engage them as the science changes and as their own career shifts. What are boosters that we need to be providing as an ongoing source for public health expertise and enrichment? We also, and again, I think this epidemic really puts a point on this, or this pandemic puts a point on this. I think a lot of other people are going to care about public health now, and they understand why public health matters. And how do we engage them in ways that are appropriate, that are accessible to them? And I put ensure accessibility here, and in quotes, in that I think we need to make sure that it's accessible both in format and in content. We are very used to talking to one another and in our scientific language, and if we want to make our programs open to other audiences and more friendly, if you will, we have to ensure that both the format and the content and how we speak and offer these programs is accessible to other learners. I'll go on to the next slide here. I think, again, this is a point that is not necessary to make in our own audiences, but I think, you know, the call for our expertise is ever growing and ever expanding in many ways. There are new topics, emerging topics. There are many of them. I put a few on here when I did my MPH many years ago. We didn't talk about food or food insecurity as an issue that was central to public health. We do now. And those are things that people want and might shift careers or might want additional information. The e-cigarettes, the vaping epidemic. I think we are, you know, continually faced with intractable problems. Vaccine hesitancy, I mentioned because it's something we thought went away, but is back. And, you know, again, how do we engage our alumni or others who find these issues to be really critically important to the work that they do and weren't necessarily discussed or part of their training program. And then, of course, we're dealing with new science and new methodologies. I'm a trained epidemiologist. I don't believe that my training from 20 years ago would look as relevant as it does now. And there are new methods in data science and artificial intelligence that I would want to engage in if I were really practicing my craft every day. And then I think that, you know, there's a newly found awareness of our needed skills and understanding. I joke that in my family and among my friends, you know, I'm having conversations about how do we flatten the curve and, you know, how do we model spread? These are terms that were unknown to people outside of our field, and we need to be able to engage and ensure that people who want training around communicating risk and around basic concepts in epidemiology are able to engage with us. If we don't do it, others will step in to do that. And we should be leading in that. So I close with this because I think the need for a high quality, diverse, and innovative portfolio for public health schools and programs has never been greater. And I think it's incredibly important that we do that. My question, I think, for the audience to put out there is, you know, as you think about your own programs and in your own institutions, what are the next critical decisions that you need to make to support a diversification of your educational portfolio? Who do you need to convince? What are the arguments and what are the cases that you need to make? They might be business cases, they might be needs for expertise, they might be people who come to you from the corporate sector or from the private sector who are now saying to us, I need your expertise. So how do we build? And I'll end there. Please submit your questions to the Q&A box and we will bring them back to discussion. And I'm going to turn things over to Trish.
Yeah, thanks again for joining us, especially at a week like this week, where we are all involved in all kinds of things, getting our students either prepared or our faculty prepared to engage in this new kind of education for a lot of us. We appreciate you being here. And as we prepared and thought about this meeting, it has come increasingly relevant with the experiences we're having this week. I have something to talk with you about, which is basically the opportunities and challenges in global collaborations. Our objective initially was to analyze opportunities for ASPPH to partner with international academic public health organizations, and we're going to look at that very briefly. But we also want to talk about what impact the COVID-19 pandemic has had on our students, on our faculty, and on our programs. So you see the two questions that we will be asking you to think about as I go through my presentation. We invite you to start answering those in the Q&A as we go along, tagging them with the number 3 so that we can follow them, and you will see them spread throughout my presentation just so we can remember that those are things that we'd like to interact with you about. I think that one of the biggest challenges in moving to the virtual ASPPH annual meeting was the opportunity to engage in a conversation with you versus this just being a one-way kind of discussion. So we really appreciate you answering the questions and posing new questions for us to talk about as well. So for starters, I joined an institution that belonged to ASPPH in 2001. And have been surprised every day when I look at the growth of ASPPH. ASPPH was kind enough to prepare this slide for us, where we can see from 1946 to where we are today, the growth of the association in schools and programs. But we're not the only association of public health education. And As far as we know, there are others that bring together institutions and members in a way that responds a little bit to what Dr. Frank talked about as well in the previous session, which had to do with consortiums and collaborations in a global fashion. So where you see 100+ members, we mean institutional members, and we can see that at least 2 other associations have more than 100 members, just like us. There are others where we don't necessarily know the number of institutional members they have. It may be that their websites aren't as representative of their membership. We don't have the same information, but we can have a look at the kinds of things they're doing. You can see, for example, in the Asia Pacific Journal of Public Health, their website, front and center, a coronavirus statement, while in others, they have pictures of who their members are. Others talk about their purpose for tertiary public health education, promotion of research and workforce, training and development. So they sound a lot like the things that we're trying to do. And the purpose of this session is to explore how we can make a better use of those collaborations as an association, since we're trying to do the same kinds of things. Is there an advantage? Are there benefits that outweigh the challenges of collaborating with each other across the globe? One example is the 10 essential services. So as we know, it's an anniversary, a special anniversary this year. It was surprising for me to learn in a meeting that I went to a couple years ago that there are several other entities that have public health essential services. Some are the same, some are different, some have 10, some have 9, some have 13. So the way essential services are defined even change in regards to who they are pointed to, who they're focused on. So are they focused on the general public? Are they focused only on health sanitary authorities? How do we define these authorities? So would there be a benefit in us having a common language across the world to understand what is it that public health is supposed to do? Who is supposed to do it? And how do we educate people who make this their job, their career, their passion? Another example could be, for example, competencies. We're not the only ones that are accredited based on competencies. Other associations do it as well, international associations. Do we have the same language? Are we expecting someone who has a master's in public health to be able to do the same thing, whether they graduate in the United States or Australia or France or the Philippines? Is it a value for us to have a common language when facing challenges like the challenge we're facing today? So I'm sure most of us have seen this map or maps like this one. This is as of about 11 a.m. this morning, ArcGIS, and these are confirmed cases in the United States. These are active cases in the United States. But as we know, we are part of a global pandemic. This is how that map looks like in regards to confirmed cases around the world. And these are active cases around the world. And as we think about the progression of this pandemic, one of the things I've wondered and I've asked other colleagues is what kinds of conversations were we having or are we having with our colleagues where this pandemic started before our epidemic? Could we have learned something from colleagues in China or Italy 2 months ago that could have better prepared us? And I'm talking about academic institutions now, not globally, but that could have prepared us for the idea of having to teach online and having to engage with our students in ways that were not face-to-face. And as we talk about challenges, how about our students who were deployed somewhere for an international field experience, our Peace Corps students? How about our faculty who were planning to use their spring break to do their research in their countries of origin? So what are some of the challenges that we could have faced in a better way, approached differently if these collaborations had been of a level that would have allowed us to talk about these things 2 months ago. Other professions have had some sort of an internal communication that's different than what we hear in the news. So for example, this week we learned, maybe yesterday, that young people are affected, contrary to what was being said at the beginning, that they can become critically ill. 2 weeks ago, physicians in San Diego were saying that they were seeing people who were younger being critically ill. So was there an opportunity for us in academic institutions to have the same kind of discourse behind the scenes? And these are the two questions that I would like you to consider, the same ones that you've been seeing throughout the slides. How have your faculty, students, and programs been affected by the pandemic? And has your organization's relationship with international entities had an impact on your response? Thank you.
Great. So as you can see here, we've got a reminder for submitting your questions and comments. And thanks to those of you who have submitted some responses. Again, you just click to your Q&A button and then enter into the field. I believe the next slide has a summary of the 3 questions that we are proposing to you. Great. So those, we'll leave those up there for folks to ponder, and I'll just summarize some of the comments that have come in so far. So Julie, thanks so much for your comments. We have some questions here sort of talking about the reality and the excitement of thinking about diversifying certificates and other kinds of trainings, not only to inform new students, whether they're coming from other disciplines, or enhancing the continued workforce development of our alumni. At the same time, one of the other respondents talks about the challenges within our institutions to actually do that. And that's what you sort of spoke to, about how we overcome some of these challenges. And sometimes we can be our worst enemies in terms of believing what has worked well so far will continue to work. So one of the commenters has mentioned that some of us need to be able to convince our academic leaders who have been in their roles for several years and consider public health an academic field that there is this need to update the curricula to make it most relevant for today. And sometimes that can be driven by a financial reason or motivation. It can be an emotional decision to change. But the question really is, how do you see individuals in their own institutions helping drive some of this conversation to not forget that there are new possibilities open, whether that's just from your own experience or from conversations that you've been having with your peers at other institutions?
Sure, no, happy to address. And I think I'll divide them up a bit. I think the concept of doing certificates or sort of other kinds of non-degree trainings, I think is an exciting one for many of us, but a bit challenging too, to sort of know, how do you explore what's really needed from the workforce. I can speak a bit from personal experience there, in the sense that we've done a few different things here at Columbia to further our knowledge of what's needed, and to be able to make a more of a business case to our leaders and the dean that we need to invest in one way versus another. So 2 things that have been really helpful for us. So we've actually gone out and surveyed alum in our institution and asked them, what would you be willing to, and we've asked them kind of content related questions, like what are the kinds of additional trainings that you would believe, and we've also asked them sort of format and delivery questions. So in what way would you be really looking for more of a one-time booster, if you will, versus would you, and do you feel like your employer would value you gaining a certificate in an additional or more in-depth skill set? We've asked people how much they'd be willing to pay for those kinds of things, and what format of delivery would they want to have them in. Do they want to come to the school? One of the things that we talk about online, and I think most people want some flexibility in being able to attain further education and further training, but they also sort of value the idea of gaining a new professional network. And so sometimes they want to come. So in some cases, we've learned that people really want more of like an exec weekend style program, because they would like the idea of not only getting some further training and further professional development, but they want to meet other people who are interested in the same things that they are doing. So it's enhancing their network as well as getting training. So I think the two places that I would start are whether asking alumni. The other thing we've done, and we have a pretty robust Office of Career Services, and we have a career fair, and we've gone to the people that hire our graduates and asked them, over time, do you feel like our graduates need additional skills? And in what would you think those would be? I mean, not surprisingly, when we've gone out and asked these questions, a lot of interest in data science skills and in kind of quantitative methods, because I think the field that both employers and alumni recognize that those methods are training and are changing, and they would like additional training. So that is one answer to that. I think on the other side of, how do we convince chairs and academic leaders that we need to make some of these changes. I do think one of the things that's helpful is doing this kind of, so it's related to the previous question, and that I think surveying and gathering data, most of our colleagues are responsive to data. And so when they see and hear that we've collected data on the kinds of needs that our constituents, our stakeholders, our alumni want and need from the school, that seems to be more impactful in many ways than just us as colleagues saying we really need to be doing more of this. We've done a couple things too, where we've, I would say in two different ways. One is inviting employers to come in and talk to faculty and to students, and having them talk about, what are the things that they're facing and the kinds of needs that they're planning, and what their workforce plans are, and how they would like to engage and partner with the school or the department. Specifically, we've done this, for example, with our Department of Environmental Health Science a few times, where we've actually brought employers who are hiring our graduates and asked them, because of that, we wanted the faculty and the chair and others to hear about that, and that's important. It's a changing field. I think so. I think it's that. The other thing around different modalities, we've invited faculty from other schools at the university who do similar work. So, for example, our School of Social Work, which one would think would be a hard field to train on in an online space or in a digital space. We've invited them in to present to our faculty and talk about some of the changes they've made and the diversification in their portfolio, so that people could see from colleagues and people that they see as peers, albeit in a different field, but academic peers. So I'll stop there.
Great, thanks very much. I think, this idea of turning to the resources that we have, turning to our students, within our networks is really powerful. And I think it's an important theme that transcends all three of these questions, sort of finding where can we build, where can we gain insights. David, I'll turn to you. I just have a couple comments from some of those watching. In terms of valuing the return on investment, we can think about it as the degrees that you showed. And one of the comments reflects that it would be useful to separate this kind of data at the doctoral level between PhD programs and DRPH to really understand some of those unique differences that exist between these degrees and career paths. So also this idea of when we're seeing those higher salaries, we begin to think about a lot of dual degree programs where it may be an MD, MPH as well. And so I'm just wondering if you have thoughts and insights similar to Julie about this curiosity about what our graduates are doing at these various levels that might be relevant and thoughtful for folks.
Yeah, well, one of my epidemiology professors taught us that there are lumpers and splitters. So, you can think about that in the context of interaction versus homogeneity of risk for the epidemiologists and biostatisticians in the audience. So, there's always a question, how much do we aggregate data when we're reporting it? And I think to this point, the issue of breaking out the PhD versus the DRPH is totally appropriate. These are degrees that are designed for different purposes. The PhD is meant to prepare people for an academic career, and the DRPH is meant to provide leadership in practice. Now, of course, there's a lot of overlap between those two areas. Many PhDs have no interest in academic careers, and many DRPHs are leaders in research. So Greenland, who's written the Bible on epidemiology, is a DRPH, and we can think of a number of other examples. The issue of the dual degrees with the MPH, I think that is also critical. What is the value of getting an additional degree on top of, say, an MD, or we also have a program in social work that we're hoping to enroll students in beginning next year. Does the additional effort, provide the return? Are they using the skills that they've learned from that additional degree in their daily careers? These are all open questions. And I do think ASPPH has the data to break out DRPHs versus PhDs and dual degrees versus standalone MPHs. So yes, I agree. Those are all critical questions that deserve further review and attention.
Great, thank you.
Could I just follow up on a comment that Julie made?
Sure.
And I wonder if we could perhaps poll students. One of the other questions was about polling students at the start of. This is from Kim Rahibi. Polling students at the start of their programs, and I wasn't clear exactly what the question, whether it was about needs or return or desired educational modalities. But I wonder, given that ASPPH has the capability through SOFIS to ask a number of questions, if that might be worth adding to SOFIS or perhaps tying a survey to SOFIS, just something for ASPPH to consider.
Great, thanks. And if I think back to when we had originally planned this session, the goal was to have it be very interactive in person in Arlington or in Washington, D.C. And so one of the things that we're also really appreciative is any feedback that folks have about how ASPPH as an entity can help all of us move forward in our institution. So please keep that in mind as we're pondering these various questions. The next component that I'd like to address that I think begins to tie into when we diversify our educational offerings, it potentially makes it easier to engage in interprofessional and transprofessional engagements, I guess, basically. And so, Tricia, the question that I have for you is really thinking about interprofessionalism and how that might present unique opportunities, or in light of COVID, sort of stress the importance of how we incentivize and get leaders to value this kind of collaboration that, granted, is very difficult, right? So just your comments and thoughts about how do we incentivize and support the kinds of collaborations that you've talked about and looked at.
Thank you, Sean. I think that this pandemic presents us with a unique opportunity to converse with other colleagues in other health professions about the need for public health, in this case, to be in the conversations from the very beginning. I believe that as we've talked in this conversation, there's more and more interest in public health. 2, 3, 4, 5 weeks in, when people start thinking about things like spread and the curve, when initially people were more worried about symptoms and how sick they could get. And we have more questions about who is getting sick. So I heard a reporter ask yesterday, why don't we know who is getting sick? The types of people who are getting sick, we don't know what they look like, the age they are, the gender. So people are starting to ask a different type of question as the pandemic progresses. And this is a unique opportunity for us to partner and collaborate with the other health professions in addressing not only the management of the pandemic itself, but communication with community. How do we get our leaders, our political leaders, to be on board with what we're trying to do? Things that in public health we are accustomed to having to do, that other health professions usually are more focused on the individual care of their patients. So now we're seeing communities thinking about how they self-prepare and not just rely on the federal government. They're thinking about building hospitals and buying hotels and what they do in social distancing. Questions like, I'm stuck at home, I don't know what to do. What kinds of things can I do? So these are really good opportunities for us to be proactive and collaborate with other professions. Something that I'd like to just single out, though, is that we have students who are practicing the other professions right now. We have students who, for example, are nurses and are being called or deployed because there's a need for all nurses to become active again. And we have them in our classrooms now having to be participants of online education. And maybe when they get home, they're so tired, they can't even find the link to the assignment that's due at 11:59. So this is an opportunity for us as faculty to be mindful of the different challenges that our students are having and to be compassionate and to have them, we know they have other lives beyond just answering our questions. And this is a good opportunity for us to model what it means to take care of people in situations like the one we're living in.
Thanks very much. And I think, you know, in response to this pandemic, many institutions are scrambling to figure out how to meet the needs of those diverse students. And thank you for bringing up the emotional impact for many of these students who don't have the frame of reference to think about how to adapt, how to cope, how to draw upon a sense of resilience to help them figure out how to maneuver through this. So that's just their lives in general across age ranges for many of the students that we deal with. But also then this idea that suddenly we are throwing students into an online environment that they may not have wanted to begin with. They chose an in-person program or learning style. And so Julie, you know, as we think about diversifying, it's really calling us to think about how we do this remote learning, not only from a sustainable and structural perspective and designing the degrees, but also from the faculty perspective. How do we support faculty to get through this right now, right? Just to survive this transition, and then really think about how are our institutions becoming more resilient to adapt to potential future needs for further remote learning.
Yeah, so I think a couple of things. You know, on a positive note, I think that we have to this move, while it's been painful and not planned in the way we wanted to, obviously presents some opportunities. I mean, we are forcing many of our faculty to become comfortable with technology in a way that they were nervous, anxious, reluctant, you know, fill in the blank to do, and they've had no other choice but to do so. I think we have obligations as programs to support them in that transition and to help them in many phases of learning to get to that. And I'll come back to that. But I think it is, you know, it's really incumbent upon us then now to build on this, right? So we've had many faculty who have been reluctant to get into this space. Now they're in it. I think we have to really utilize the knowledge and the skills that they've gained, and then turn that into productive conversations about how we may not want to go back to, you know, having to Zoom every one of your classes for the foreseeable future, but you you saw what technology could do. You engage with your students in a different way. How do you bring that into a productive conversation about what do we do next? What's the next generation of your class? You've taught it this way for many, many years. You've now taught it this way for the last 2 months when we finish the semester. How do we look forward to next year, and thinking about how do we take some of these tools, improve the pedagogy of your class, improve its delivery, make it more accessible to many people. You know, this will not be the first time that this happens. And it will not be the last time. I mean, this might be the first time, sorry, that this has happened to us to this degree, but it won't be the last time. I mean, we will see new and emerging infections and viruses mutating and coming back. And we can't just say, well, that was this aberration, we're going to go back to just the way things are. So, you know, I think one of the questions that came up was, you know, how do we convince faculty? Well, this is how we convince faculty now. Like we had to do this. We would have much preferred, you know, as Trish said, we should have been having conversations with our colleagues in China saying, wait, how are you delivering education? You know, instead of just sitting there and watching the epidemiologic data and sitting back and saying, that's so interesting to see what's happening over there. We should have been having conversations with our fellow schools saying, well, what'd you do? How did you transition? What kind of formats did you? How did you train your faculty? We didn't. And then we were all caught sort of flat-footed. So, you know, I think it's a really nice opportunity. I do think the other thing is, I think we also have to be very cognizant of how do we prepare and make sure our faculty are supported in this journey, right? So, you know, journey phase 1 is how do I actually find Zoom on my computer and get up and running. But the second phase is, you know, how do I adapt some of my learning activities and some of my exams to be more appropriate for the technology and the situation I find myself in? How do I look, well, maybe beyond Zoom, and maybe that was really interesting for the first week or two, but maybe I need to record something so that I can have discussions and chats with my students in a different way. You know, we told faculty yesterday, you know, the accreditation and you know, here in New York, but in others have given us a lot of leeway in terms of how do you deliver in a distance education modality, and we should take advantage of that. And once we get through this, you know, first 2 weeks of learning, we should really be empowering people to take things to the next level and really provide ongoing training and support to the faculty. We've put up a feedback page on our website, so the students can also give us feedback, like that didn't work at all for this particular class and I'd like to see something different, or that was a really great exercise, so we can share among and between the classes. So I think this is an opportunity that we have to seize in terms of we need to diversify. This pandemic has only showed us that the need is more urgent than we thought, and we should take our lessons learned from this and help prepare for the future.
Thank you. And I think you raise a lot of really good points, and particularly as we think about having compassion for our faculty, right? And this leap that we are all undergoing while we're dealing with our own personal challenges, or, you know, these professional challenges at the same time. So David, I think I'll ask you a bit of a question regarding this experience of online education. Particularly in light of this idea of how do we help students learn what's most important for them now, right? But also gearing them up for this uncertain future that we're all trying to figure out. So comments or reflections?
Right. Yeah, so the date that our university is going to reopen keeps getting pushed back. We're now making contingency plans for the summer to be online. Hopefully by fall, we'll be back in the classroom. But even if not, I think we've given undergraduates in particular a taste of what online education is like. This might cause them to run as far away as possible from online education, given, you know, the challenges that Julie was citing. But it could also show them that this is a viable means of learning. And we may see increased growth in online education at the graduate level. So I think we also need to have compassion for our students who are going through quite a bit. All of our Loyola students had to move out last week of their dorms, and it's just been a huge upheaval. We've been as generous as we possibly can be, and we do appreciate CEF giving us some leeway in terms of practicums and other experiences.
Great, thank you, David. And we have just time for one more question and comment, and this is to you, Trish. You know, as we think from this piece of how we're individually dealing with this, we're trying to think about the balcony level perspective about global perspectives and conversations and collaborations, but this challenge of shutdown, right? This sort of what's a default human behavior in times of crisis. So comments from you regarding that, Trish?
Thank you, Chan. Absolutely. I think that anytime there's a crisis, our first impulse is to gather troops and shut down and get everybody under the wings. And the last thing we want to do is extend ourselves and collaborate with others, because we're trying to handle our own problems and solve them as swiftly and easily as we can. And I think that as public health professionals, especially in academia, we have a responsibility of reminding everyone of the need and the usefulness of keeping those lines open, that we can learn from each other, that the other countries aren't the enemy, that we can not only teach, but we can also learn. And one of the things that we first did was think about where our students were and bringing them home. There has to be a time when we're able to use things like these to help them learn where they are. And that's tricky, but that's what public health is. You can't always leave. Sometimes you have to stay. And then having that opportunity to see the benefit of opening the windows when everyone is shut down so that you can hear your neighbors and they can hear you is something that we need to learn, and as public health professionals, we need to be able to support.
Thank you, Tricia. I'm reminded that, you know, our individual challenge is to craft lives of meaning and purpose. And sometimes we are confronted by challenges that really force us to re-ask that question, or to ask that question in new ways. So I want to thank David, Julie, and Tricia for sharing your expertise and perspectives with us. And thank you to the participants for submitting your questions. And on the behalf of all of the presenters, thanks very much for joining us. I'm going to turn it back to Liz to wrap things up.
Thank you, Sean. Again, you could access a recording of this webinar shortly on our website, and we encourage you, if you like the content, to disseminate the archive link to your peers via Twitter and other means. And please note that these virtual annual meeting sessions run through May 15th, which you could learn about more on the next slide on the ASPPH website. And the next webinar is Frameworks for Shifting Campus Climate to Promote Inclusion. And it's going to be Friday, May 27th from 1 to 2 p.m. Eastern. And lastly, we at ASPPH celebrate all of you, presenters, our audience, for your hard work. And we encourage you to keep calm and carry on leading for academic public health. This concludes today's webinar.
Thank you all.